Thank you, Lisa. So we actually had talked about what each one of us may summarize, and when we huddled this morning, we said, well, after yesterday, boy, our heads were spinning. And I would just add, after the last session, my head is spinning. So there's many things I would like to say, but I do want to lead with what I had planned to speak about. I think we've heard consistently through this that whatever we do, whether it's care redesign, whether it's facility redesign, whether it's technology, we must keep the patient and the family at the center of that. And that's more than just us having that as the professional caregivers, having them at the center. We must invite them into these processes. We heard yesterday from Mary Jackson-Scoggins. We heard messages from my colleague to the left here who will say more. Of the importance of the voice of people who are going through the experience of cancer. As you recall yesterday, Ms. Scoggins talked about when somebody hears that word cancer for the first time, they go numb and they don't hear a lot after that. And so that is where the caregiver from the family or the friend network becomes so important to be included. But it's also a way, I think, of really understanding the importance of the team. And we've talked about the team through several of the presentations. That means the redundancy that team members can bring, particularly in those early days and weeks of a cancer diagnosis, is particularly important. And so as groups really look at becoming teams and then high-performing teams, understanding that this is not about segmentation of I'll do this, you do that, although there are those roles. It is about building in redundancy also so that there's clear messaging. It didn't come up specifically, but I'm going to talk about Deb Mayer, who is sitting in the audience, who's a nurse practitioner among her many hats, because right now she's the interim director for the survivorship program at NCI. She's on faculty at UNC, et cetera, and she's a good friend and colleague. And knowing that she sees breast cancer survivors in her clinic, we talked about this and this issue of transitioning. And she said something to me that I think is something that all of us need to hear and to get captured. We set the expectation, we the providers often set the expectation of how long we're going to have patients in our practices, in our cancer programs. And so it's important, there are those, and this was acknowledged, there are patients and the families that we will retain because of the complexity perhaps of their care. But there are many, and we know that, we saw data along the way, that could go back to primary care, internal medicine, back to community level care. But sometimes we don't set that expectation. So then patients become perhaps afraid of not staying connected. So I think as we continue to keep the patient and the family at the center of what we do, there are a lot of questions we should be asking. We certainly heard a lot of research going on here and questions being asked and answered here. But I think there are some others we haven't thought about. And I think one of them is, if we're going to be transitioning patients because of the growth we're going to see of survivors, and there is no size of a workforce in cancer, I believe, that will ever be able to meet all those needs. And so we need to broaden that. We need to be engaging patients and families and asking those questions. So that's where I'm sort of coming to the conclusion from my perspective. And then, of course, there's all sorts of things from the prior session that would be very interesting to contemplate as well. But I'm going to pass this on to Hildy.